Hello, I'm Porter. I'm going to be your nurse today. Can I get your name and date of birth, please?
My name's John Doe, 1/11/1984.
All right, John Doe, 1/11/1984. Looking good. Well, luckily, I had the right patient today. That's always a plus.
Oh, yeah.
Start. Now, John, do you have any allergies?
No, not that I know of.
Alrighty. Well, I'm going to go ahead and provide privacy after I'm done lifting up your bed, so I save my back. Is that alright?
That's fine by me.
And then we're going to be doing a really quick, I'm just going to check your vital signs, and then we're going to do a cardiopulmonary assessment. Does that work?
That's fine by me.
I'm going to be listening to your lung sounds. I'm also going to be listening to basically how your heart sounds, alright? Alright, so provide privacy. Whoosh.
Yes.
Alright, so I'll first start with your blood pressure since we're right here. Does that work? Awesome. Alright, now I'm going to be putting my stethoscope here. Okay. There we are.
Oh, so your mom and dad are divorced.
Alright, your blood pressure is 126/84, so that's looking good. And now I'm going to listen to your, or I'm just going to feel your radial pulse just to make sure you have a pulse, and I'm going to count.
Alright.
So while he's doing this, I'm going to be looking for chest expansion, and I'm first going to actually see how many breaths he has, and then after I'm going to listen to his, or I'm just going to take his, respirations, and I'm going to take his radial pulse. So I'll listen to that now. All right, looks like you had 16 respirations, and then let me go ahead and feel your radial pulse.
I mean, they can't base, if your parents are not providing anything for you, they cannot base anything on, like my girlfriend's son.
All right, you had about 82 beats per minute. That's pretty good for a person your age. Now I'm going to go ahead and take the pulse oximeter, which we don't have one, so I'm going to go ahead and put it on. I'm going to put it on your middle finger, and it's just going to measure how much oxygen's in your blood, all right? Or is attached to hemoglobin in your blood. Awesome. It's looking like it's a 99, so it looks like you're getting good oxygen perfusion around your body. That's positive. And the final thing I'm going to do is I'm going to take your temperature. I need to be on that side of them. So what I normally would not lower the, or I normally wouldn't lower the bedroll like that. So we're just gonna act like that now.
All right.
All right. Luckily he's a stable guy. Pinch it down. All right. Take your temperature. Beep. Awesome. Looks like it's a 98.6.
All right.
It's a perfect temperature. Alrighty. Now I'm gonna be first listening to your carotid artery in your neck, just to see if you have any, or just to make sure you have good blood perfusion up to your brain. All right.
Alrighty.
So I'm first gonna be feeling around on bilaterally on both pulses. You have a pulse there. Good. You have a pulse there. Now you don't. It looks like you don't have any jugular distension, which is a positive. It's very good.
That's always good.
And when I listen to your, I'm gonna listen for bruits around your carotid artery. So I'm gonna use the bell to listen for that. So go ahead and hold your breath. Alrighty, you're looking good. One more time. Awesome. You don't have any bruits, which is a positive. And now we're going to go down. Is it okay if I expose you really quick?
Yeah, that's fine.
All right. I'm just gonna go all the way down to your feet. Okay, so we'll start. You know what? We're gonna listen to your chest sounds first. All right, I'm gonna go ahead and expose your chest too. Is that all right? I gotta listen to how your lungs feel.
That's fine.
Now I would never listen to his lung sounds through the clothing of this shirt, just because it could mess up what I hear. So. All right. So first I'm gonna listen to your lung sound. So every time my stethoscope hits your chest, I need a deep breath. All right. Okay, go ahead. Alrighty. One more. And again. 3 more. 2 more. Last one. Awesome. Now I'm going to check for protrusions on your chest really quick. Awesome. Can you take one more deep breath for me? Alright, so you don't have any protrusions on your chest, and bilaterally your chest both sounds good and looks good when you on exhalation and inhalation, which is a big positive. And now I'm going to be, actually let me raise the bed really quick. I need to change how the bed looks because I gotta get your back too. We're gonna be raising you up. While I'm doing this, his skin on his not only arms but his hands look really good. I'm gonna be checking for a bilateral. Ooh. Sorry, John. Let me raise you up here. Alrighty.
Oh, thanks, Porter.
Alright. Okay. We'll leave you like that as of now. Is this comfortable?
That's comfortable
I hope
with
so.
me.
I hope so. Okay. So I'm gonna be taking your brachial pulse. You're good there. Let me take it here. You have bilaterally. You have good brachial pulses, and let me take your radial pulse. Good. And then good. Bilaterally, you have good perfusion to both arms, which is a big positive. So let me go ahead. I'm gonna kind of fold you up, and and your arms are gonna look like this. So you're gonna be leaning over, and I'm just gonna listen to the sounds, well, your lung sounds in the back of your chest. Is that all right?
That sounds good with
All
me.
right, so just go ahead and lean you up. You're gonna hold on to it. That'd be awesome. Thanks so much. Okay. All right. It doesn't look like you have any bony protrusions back here. That's a positive. And then let me go ahead. And every time my stethoscope hits again, I need you to take a deep breath for me. All right, we're just gonna do 4. All right, so go ahead and take your first one. Your second one. 2 more. And last one. Awesome. Now you don't have any coughing or any like septum come up whenever you're breathing, do you?
No, it's usually just a dry cough.
Okay, good. And then no chest pain, no heartburn or like chesting or anything like that?
No, not really.
Okay, good. Now I'm going to go ahead and listen to your heart sounds. Is that all right?
Yeah, it's good with me.
Okay. So the first area of your heart I'm going to listen to is the aortic valve, which is up on his second. It's on his second intercostal space. Perfect. And I'm going to listen to the Urbis point, which is on his second intercostal space on his left side. And then we're going to move down to listen to his tricuspid valve, which is on the... No, actually take it back. Third intercostal space for his atrial. Third intercostal space for his Urbis point. Fourth intercostal space for his tricuspid valve. And then for the mitral valve, it's a 5th intercostal space, and we'll listen to that as well. Good. Your heart sounds good. Now when we do this, we would also do it. We're also going to listen to the bell, and I would go backwards, but to save time, we're not going to do that right now. Now we're going to lift you back up here. Is that all right? Awesome. Now I'm going to go ahead and check for capillary refill in your hands. So I'm going to squeeze for 3 seconds. 2, 3. Good. And redness comes back to your... Good. So you have good capillary refill. Now your hands feel warm bilaterally, and you don't have any edema. You don't have any redness or swelling. You haven't noticed anything, have you?
No changes really.
Okay, good. Now I'm going to move down to your feet. Let's get them out of here. You know what? We're gonna go backwards. Actually, we're gonna go this way because you're. Okay. All right. Now I'm gonna first listen to your dorsal pedialis. I'm gonna listen bilaterally to see if you have. Good. I'm gonna listen to your posterior tibialis. All right. Your heart rate sounds good on your feet as well. Now I'm gonna make sure your feet are warm to the touch, which they are. I'm also going to make sure that if I couldn't listen to your basically heart rate in your feet, I would use a Doppler, so I couldn't get that out. And then I'm also going to make sure that, really quick, you don't have any bony protrusions. Good. I already checked that. And I think that should be it.
All right, sounds good.
Alrighty, now I'm going to go ahead and raise you back down, and we're going to lower you down. Is there anything else you'd like today?
Milk and cookies.
Milk and cookies. Alright, I'll be getting that for you really quickly. So you don't have any chest pain, no cough or septum, none of that?
No, not really.
That's positive. Good. Well, it seems like your body is functioning pretty well.
Well, we love to hear that, don't we?
At least cardiovascular-wise and respiratory-wise. That's a very good thing.
Well, that's two of the most important systems in the body, isn't it?
I hope so. I hope so. Now, after this, I'm going to document my findings and perform hand hygiene. So once this bed's done. Sorry, this bed takes forever to lower.
Nah, that's okay, man.
Come on. Awesome.
Low position.
All right, are you comfortable? Yes? You comfortable?
Yeah, I'm comfy right here.
Awesome. All right, well, if you need anything else, let me know. I'll be back for that cookies and cream here soon, all right? All right, you have a good rest of your day.